David Kilmurry. Hello.
How are you doing? You okay?
I'm fine. And you?
Excellent. Yes, I'm absolutely wonderful. Thank you very much.
Bueno, él está regio allá en Londres. Are you in London?
Yes, I am, in Harley Street.
En la calle Harley. Y le vamos a preguntar, ¿cómo funciona esta hipnoterapia? So how does hypnotherapy work?
Hypnotherapy is, as I would describe it, a medical intervention which is now a viable, recognised tool for change. And that's what I carry out on a daily basis with my wonderful clients.
Bueno, la hipnoterapia, lo describo como lo describo yo, es una intervención médica ya reconocida que es una herramienta que cambia el comportamiento en lo que él llama sus pacientes maravillosos. Well, entonces yo leí sobre esta mujer que logró adelgazarse sin tener que hacerse la cirugía. Well, I read about the woman who you convinced or made believe that she had had a gastric bypass and she lost a lot of weight. Can you tell us about that?
The gastric bypass is something that is also we help to convince the subconscious part of your mind that you have an operation. Well, you've had an operation. During the hypnosis, the subject will have had a number of suggestions, and it's not done in one session. This is something that has been built up. But the actual gastric operation is powerful and is something that that subconsciously we take on board. So basically the subconscious part of the brain does take on board and does accept operations. It's as if you're actually there for some people. Some people actually feel the same feelings. Some people actually get the same emotions. Some people get this. I see some people holding hands or squeezing the hands if they're squeezing the hand of the nurse that's there looking after you. It is quite powerful.
Bueno, este procedimiento que se demora varias sesiones porque se va como construyendo, es que se convence la parte subconsciente del cerebro que ocurrió a través de sugerencias una operación. Y la gente lo cree tanto que muchas veces tiene comportamientos como le agarra la mano a la enfermera y se la tiene como uno haría realmente en la clínica, y es muy poderoso. La mente lo acepta y después el comportamiento cambia. So the mind accepts it and the behavior changes.
This is correct. Well, consciously, you could be thinking about all sorts of wonderful things. It's like sometimes you go to sleep at night and you'll be dreaming about something, although you'll be very aware that you've got your child in the other room and so on. You're aware of different things with different parts of the mind. We separate conscious and subconscious, and the subconscious is the part of the mind that accepts this gastric operation. It's very, very powerful. It's the part of the brain that looks after you, that holds your motor functions, your motor skills, and your learned behaviours. And that's why this is so powerful, because the learned behaviours are something that are the reason why you've put the weight on in the first place.
Sí, es como entrar en esa tiniebla, en ese momento, como cuando uno se está quedando dormido por la noche y uno empieza medio a soñar, pero uno está consciente de ciertas cosas. Diferentes partes de la mente están actuando y conscientes, y el subconsciente acepta la idea, en este caso de la operación, y esa parte de la mente es muy poderosa porque es donde se controlan, digamos, las habilidades motrices, los comportamientos aprendidos, y que esos son además los comportamientos que lo han engordado a uno. Entonces opera a ese nivel. So this hypnotherapy can be used. Esta hipnoterapia se puede usar, pues, digamos, para adelgazar, para algo así extremo como creer que uno tuvo una operación, for sort of the more extreme case of believing you've had an operation. But it also can be used I read on your webpage, he leído en la página de él, que se puede usar para otras cosas. For example, panic attacks, anxiety having to do with not letting somebody get pregnant, fobias para ataques de pánico, ansiedades que a veces no dejan que las mujeres queden embarazadas y entonces a través de la terapia acaban embarazadas, pánico escénico, fobias. Can you tell us a little bit about that?
Yes, of course. All we're born with is the fear of falling and the fear of loud noises. The rest of it we learn on the way. As we collect these thoughts and learnings, we are all unlimited. We're limited by our thoughts that we pick up and that we develop on our travels. Our fears, for example, which lead to the anxiety. Some people just don't seem to have fears, and they're people that have turned into it, have just developed in some way. The other thoughts that we can't fall pregnant, or thoughts that we're too stressed, can be quite powerful and can control us and can give us psychosomatic illnesses such as irritable bowel syndrome, stress-related stomach ulcers, stress-related heart issues, and that's something that hypnotherapy can help as well.
Bueno, los únicos temores con los cuales nacemos son el miedo de caerse, del vacío y de los ruidos fuertes. Todos los otros temores y miedos los vamos adquiriendo en la vida, creando en el camino. Y esos pensamientos negativos y miedos van limitándonos de una manera. Hay gente que no los acumula, pero mucha gente sí. Y entonces esos pensamientos, que estamos demasiado estresados, que no vamos a quedar embarazados, empiezan a tener una realidad propia y nos afectan. Hay muchas enfermedades y condiciones psicosomáticas. Eso quiere decir que comienzan en nuestra mente y se manifiestan en nuestro cuerpo. Y muchos tienen que ver con el colon, úlceras, y además hay ciertas enfermedades también del corazón que empiezan así. Entonces yo le quiero preguntar, bueno, entonces yo quiero ir donde él. Tengo algunos síntomas. ¿Cómo es una sesión? So I have some symptoms and I want to go to you. What would I do? I call for an appointment. How many sessions would it be? How does it work?
Well, it depends. There's a lot to it. Sometimes we won't have anyone. We won't just work with you just willy nilly. We want, or without going through a procedure with you. So we'd educate you onto how things have got to where they've got. We're all a result of our environment, and what happens to us makes us the person that we are today, and that's a given fact. It's not counselling. Counselling can go big round and round, and it can be over a number of sessions. This is powerful and can work within just 1 or 2 sessions sometimes. The gastric operations take 4 sessions. The first session is usually an introduction to hypnosis. Most people haven't really had hypnosis. It teaches the subconscious how to accept these subconscious thoughts. Most people have lost weight from session 1 to session 2. Then session 2 and 3 are about developing confidence and also dealing with emotional issues, late night eating, sugary cravings, getting rid of these things, and also motivation to exercise. So by the time we've got to the gastric band and gastric operation, the person has lost weight, is feeling confident, has dealt with a number of their confidence issues and issues around and surrounding food and exercise and well-being. And the focus on health has allowed the person to have lost some weight. Usually they've had the hair done as well, and they're feeling good about themselves. By the time they get to the session 4, where we go into the gastric operation, which is very powerful and can actually feel, some people actually get the same sort of pains that you get in an actual gastric operation.
Bueno, todo depende. Estos procedimientos no es así nomás a la loca tolondra. Hay una especie de introducción, educación para el paciente, porque todos estos miedos todos lo tenemos y nos hacen hacer lo que hacemos. Y esto no es una terapia, es una herramienta más bien poderosa. Y generalmente, por ejemplo, para pérdida de peso puede hacerse en 1 o 2 sesiones. Para la operación gástrica son por lo menos 4 sesiones. La primera es una introducción a la hipnosis y le enseñan en esa sesión al subconsciente a aceptar lo que es la hipnosis, porque la mayoría de la gente no lo ha experimentado, y generalmente entre la primera y la segunda y tercera la persona empieza a tener mucha confianza, ya ha recibido esos mensajes emocionales que tienen que ver con esos temas de comer tarde por la noche, de tener ansiedad y buscar comida dulce, por ejemplo, y motivación a hacer ejercicio, a dejar de comer. Y ya generalmente en los casos de estas operaciones gástricas imaginarias, ya para la sesión cuando lo van a hacer, la persona ya siente mucho más confianza y ha perdido ya peso, porque hay un enfoque que se va creando hacia la salud. Y muchas veces cuando ya llegan a esa sesión, la persona inclusive ya está tan metida en el cuento que siente los mismos dolores como si la hubieran operado de verdad, y es así de efectivo. And what does this cost, and how can one get a session with you?
Well, it's a different range in my practice in Coventry as opposed to my practice on Harley Street. And it would depend on which type of treatment. The most expensive treatment is to become a non-smoker, because smoking is quite expensive, and it's a pledge in a way, and that costs £395 for the treatment. It takes 2 hours, and the person will walk out as a happy non-smoker, never to touch cigarettes again. There are other treatments across the board that sometimes take more sessions, like the weight loss program, which I carry out, which has been extremely successful and have pretty much worked nearly for everybody, unless you have a reason to maintain the weight or like a secondary gain. For example, if you felt more comfortable in a larger frame, then it's going to be very difficult to help you. If, for example, you've had unwanted male attention, or if someone has had some form of sexual abuse in the past, where they've felt more and they feel more comfortable in a larger frame, then weight loss will not occur. But obviously we'll be able to try and help with the emotional issues that are there attached to the abuse that you may have suffered.
And how far apart are these sessions?
Usually 7 to 10 days is the ideal amount. With psychology, a number of psychologists say that that habits are formed within 3 weeks. So for the habits to be formed, we want the program to be lifelong, like lifelong changes. We would like them to be over 7 to 10 days for each one. So we're going to be at much more than the 21 days that the top psychologists have suggested. So that means that the habits, there's going to be a number of habits that are reformed and that are formed, new habits, healthier habits that will become automatic and natural. So basically, the program is usually be over at least 21 days.
Okay, let me just translate. Bueno, okay. El costo varía. Hay una diferencia. Él tiene 2 oficinas, uno en Coventry y uno en Londres, en Harley Street. Y dice, por ejemplo, el más caro es para dejar de fumar. Y es casi como una promesa. Dice que cuesta 395 libras esterlinas y son 2 horas. Pero que usted sale feliz y no fumador. Y que jamás va a volver a tratar de fumar. Otros, digamos el de pérdida de peso, y creo que se está refiriendo a esta operación gástrica, es más caro porque es más largo y funciona, es exitoso. A veces hay una persona que tiene una ganancia en ser gorda, se está escondiendo, digamos, de traumas del pasado. Por ejemplo, si ha tenido un abuso sexual, algo en su niñez, y entonces realmente es demasiado difícil dejar de ser gordo porque ser gordo es algo que lo está protegiendo. Esos casos son más difíciles, pero para una persona que no tiene estos temas, funciona muy bien. ¿Y en cuánto tiempo? Entre sesiones, él dice que 7 a 10 días es lo ideal, porque los hábitos, dicen los psicólogos, se forman en 3 semanas. Entonces hay que replicar eso o extenderlo un poquito más para crear nuevos hábitos para que las cosas se vuelvan automáticas y normales. Bueno, yo le quiero preguntar algo ya que es una curiosidad que yo tengo. ¿Será que uno puede en una conversación normal ser hipnotizado? This is just like a personal question, but can somebody hypnotize you in a normal conversation?
Yes, you can pretty much hypnotize. Hypnosis is everywhere. You could hypnotize someone walking down the street, and we all get overloaded consciously when we're driving and when we're doing certain things like on the laptop and so on. And when we're watching television, we get hypnotized by the television. That's why the adverts come on, because we're very receptive to suggestions, and that's why they try to make the adverts become part of our subconscious, so that when we're in the supermarket, we will automatically pick up the branded products that are there, overloaded and etched and tattooed into our brains, if you like. So the answer to that question is yes. You can hypnotize people, you can overload people, and you can make suggestions just on a personal basis without closing your eyes and without going into hypnotic trance, without being too deep. Bear in mind that working with someone with anxiety, they won't relax that much, or someone that doesn't have that has a lot of stress will struggle to relax initially, and the treatment still works. It's part and parcel of this. Is you don't actually have to go into a very, very deep trance state to receive a beneficial therapeutic suggestions that become part of your neurology.
Okay,
part of your brain, rather.
Okay. Pues sí, la hipnosis está en todas partes. A uno lo pueden hipnotizar y de hecho uno queda hipnotizado muchas veces caminando por la calle, manejando, porque se sobrecarga el cerebro con la pantalla, con las pantallas, con los laptops, con la televisión. Por eso es que meten esos anuncios en la televisión, porque uno queda medio hipnotizado por la televisión y entonces uno está más receptivo a las sugerencias que le hacen a uno, y por eso es que después uno va al almacén y automáticamente compra el producto que le vendieron o le hipnotizaron para ver durante el programa. Y por eso es que él dice que es casi como si fuera un tatuaje en el cerebro. Queda uno con eso quemado ahí en el cerebro. Entonces, la respuesta a eso es que sí, hay gente que tiene mucha ansiedad y tiene más resistencia, pero uno no necesita quedar, digamos, profundamente en un trance para quedar hipnotizado. Pueden haber sugerencias que le llegan a uno en un nivel más ligero que de todos modos son efectivos. Bueno, yo creo que este tema es fascinante y podríamos hablar todo el día, pero no tenemos el tiempo. David Kilmurry, I think this is one of the most fascinating topics ever. But we're running out of time. So
what a shame.
People,
it's been lovely talking to you. Thank you for interviewing me.
Okay. So does it have? I just want a practical question. Does it have to be in the language? People have to speak English to be hypnotized by you?
Yes, really. You need to have You need to have words that will become poignant for you. You need to have a translator if and sadly, we can't hypnotise in a different language. Although certain words are universal, you would need to listen to and have something that's poignant and relevant to you and that suits your modality. Some people are more susceptible to visual words, and some people are more susceptible to auditory words, and some people more kinesthetic words. It's about how people feel, and it needs to be poignant. It needs to suit the person, and you need to have a passion for this as well. You need to be able to deliver it with such a way that is going to make the responses happen for the person as well. But,
okay. Bueno, los que se quieran hipnotizar, pues pueden ir a Londres con David Kilmurry. Eso sí, Preferiblemente tienen que hablar inglés porque las palabras tienen que tener una fuerza emotiva para uno, para que lo puedan hipnotizar. David Kilmurry, Cognitive Behavior Hypnotherapy. Podría solucionar muchas cosas en la vida: no fumar, no comer, no tener pánico, quedar embarazado. Well, the applications are endless. Thank you.
Thank you very much for having me. I really do appreciate it. You've been lovely. Thank you.
Bye-bye.
Bye-bye.